There's a couple of exercises and a couple of things you want to consider if you just had surgery on your knee. Now, first of all, most of your surgeries for the knee are going to be serious enough where the doctor is going to encourage you to do some physical therapy and get involved in a protocol-based care. We're talking about your meniscus repairs, we're talking about your knee replacements, obviously your ACL reconstructions. But there is some gray in regards to the simple arthroscopic surgery, which is where the doctor will go in and just sort of clean out the debris inside the knee, the cartilage that might have been fraying a little bit, just sort of clean it out and make it a little bit a little stronger for them. They'll come out of surgery doing pretty well, and sometimes the doctor recommends some physical therapy in a skilled place. Sometimes they recommend just going home and working on a few things. So it's that population that we're worried about. The key with your post-operative patients compared to your, just so your tendinitis, your overuse injuries, is the importance of daily exercise and maybe even more than one time a day of exercises. Anytime you have surgery in a knee or a shoulder, there's this responsive scar tissue formation. It's accelerated, and with each passing day, it's starting to harden and harden. Think of glue or clay, but that takes months to harden rather than hours, let's say. So you have to stay on top of things that first week with stretching and with exercises. Specifically, you're going to want to do exercises that are designed to help pump the swelling out of your knee first. So we're talking about your isometrics. That is your quad sets and your hamstring sets. It's very simple to do. You can do it on the floor or on your bed even. And once you've done the isometrics for a few days, you might want to consider now doing some range of motion exercises. Simple heel slides or just sitting and bending and straightening your knee work just well. And that might be started, the first week and a half after the injury. The key is to not do too little in the beginning and then also not do too much too quick. So returning to the gym too early is a no-no. You might accelerate the strengthening, but you also might cause more harm than good with the options you might choose. Too much weight bearing on that unstable knee can really lead to more damage than good. You can disrupt the healing as well as create new problems. So you want to be a little careful getting back to the gym too quickly, and then you need to be fairly diligent and pretty progressive the first few days, especially that first week, staying on top of it, exercising more than one time a day with isometrics and some simple knee bending and straightening exercises.